We'll come back to this. We'll go to the High Commission for that news conference. But let's talk education now. Some senior high schools in the Ashanti region have decongested their classrooms and dormitories as final year and gold track students return. Authorities have also taken delivery of all materials needed to ensure adherence to COVID-19 safety protocols. Now, Jima has been speaking to school authorities and filed the following report.
Some teachers positioned themselves at the entrance of Opokuari School to take temperature of visitors and students. On all walls and in all corners are visible notices on hand washing, wearing of masks and sanitizers. Veronica buckets provided by government are dotted around school premises to encourage people to wash their hands. Dormitories, previously accommodating 40 students, will take a maximum 20. Here is Headmaster Reverend Father Stephen Osuseche.
We have distanced the desks in our classrooms. We have big classrooms and smaller classrooms. The bigger ones will not go beyond 30. We put 30 students in the classroom. The smaller ones, you have 25. So you have your name, your number, and your name on your desk. That's where you sit for classes, and that's where you sit for prep. We are working closely with South Ntoso Government Hospital.
Students at the school at the time of our visit were being handed hand sanitizers and face masks. They then went round to locate their names at new dormitories they have been placed.
We thought the virus was still out there and it was quite unsafe, but arriving in school we realized that even if the virus is still around, we can have our way around it because there are so many safety precautions out there, and if we are to adhere to all of them, we believe that we will be safe.
The social distancing and other protocols won't be easy though, but that's what you have to do to survive, and that's what we are going to do. Yes.
At Sakafia Senior High School in the Askoremampo municipality, only a handful of students had reported when we arrived. Headmaster Mohammed Shahid explains management is working with Municipal Assembly to ensure all requirements are met.
Our major challenge has to do with beds and mattresses. God being so good, I think 3 days ago, I called the Deputy Minister of Education. I think quickly, together with the MC, they collaborated, and then beds have been provided. We have enough beds to occupy the students.
The situation is same at Kumasi Academy and Kumasi Secondary Technical School. Kumasi City Mayor Osei SB Entry went round to acquaint himself with developments in various schools.
When the children were at home, in fact, the use of the mask was nothing new, because even at their various homes, they were using the mask. Moving out, it was compulsory that before you go out, you have to wear the mask. And you know, senior high school children are of age, and they will not always be limited by sitting in the various homes. So all the children that we've interacted with, all what they said is that it's just continuation of the COVID protocols here.
Meanwhile, some past students of Opokuari School have assisted the school with sanitary items. Emmanuel Boachi Yadom leads an initiative dubbed Support Your Alma Mater campaign.
As part of our social responsibility to complement the efforts of the government, I think we came together with the idea of helping our various old students, old schools, that is our alma mater, which the JHS and SHS fall in place. Today we're able to gather some Veronica buckets, tissues, liquid soaps, face masks, and then the thermometer guns. So we made the presentation today, and I think it will go a long way to help combat the situation.
From Kumasi for JoyNews, Nana Ojima reporting.
Now on the AM show today, the president of NAGRAT, Angel Kabonu, Education Inspector Auntie, and the head of the psychiatry unit at the Konfonoche Teaching Hospital, Dr. Rose Osuentry, spoke on how these students can be made to feel at home.
What the medical persons gave us was a blanket no, indicating to us that the numbers were growing. The fact that we had been able to ask students to go to school. So that was what we communicated to government at that time. that, look, the medical people are telling us that the dynamics have not changed, and they are still having problems in identifying the nature and behavior of this disease. Our numbers seems to be going up. So you recall that our first statement that came indicated that the grounds were not fertile for students to return to school. What informed that was our contact with some medical persons and the advice they gave us. Let me state clearly that we are not professional health workers, so we will not be able to give that specific counseling that pertain to the health of the student with regards to COVID-19. By our training as professionals,
this has been a very difficult decision for all of us, parents, teachers, we who are studying the sector from afar, the ministry, Ghana Education Service, and even the students. There were mixed reactions when the idea was mooted that the schools need to be reopened for especially the graduating students, something that we at IFES have been advocating for over the months, that we need to make sure that these students exit from the system so that we have a clear pathway for how we go about our education after the coronavirus, or when the pandemic is brought under control. So there were back and forth here and there, but finally we are happy that schools reopened yesterday. I think it was Saturday, Sunday that the students were supposed to report on campus. There seems to be a lot of energy from the part of the various school authorities, especially because most of them...
I've been a bit concerned because I realized that the government did very well, provided PPEs to the various schools, cautioned them about stepping up the preventive measures and all that. But it seems that everyone forgot about emotional PPEs, which is very essential in the whole of this pandemic. Students are going back to school. What kind of emotional PPEs have been dispatched to them? Both their teachers, their parents, and the students themselves. And I think that we have woefully done inadequately in that sense. People are anxious, parents are anxious, the students themselves are anxious. Teachers may be uncomfortable as well and may be entertaining their own anxieties, even though they may put up a brave face. And so I thought that there will be measures in place to educate these students, educate their teachers, tell them how to handle the anxieties that may come with students coming back to school and all that. Tell them that when students are anxious, where do they go to? Who do they see? Is there a counselor on site? Is there a mental health expert on site? I didn't seem to see that aspect being visibly affected into students going back to school in all of this. Our colleagues elsewhere have set a very good example that we should follow, albeit late.
And Dr. Ruth Osuentri is head of the psychiatry unit at the Comfort Noche Teaching Hospital.